Swallow this medicine, this one too.
This is one of the 3 children of Alice Akello suffering from a mental illness. However, the mental health experts say there are different forms of mental illness with a range of possible causes.
Mental illness cannot be related to one thing. So there are a number of factors, for example, genetics. Yes, if one person in the family or one relative had a history of mental illness, it is very possible that either the children can also get mental illness. Then there are other factors, trauma, if children got any traumatic experience. For children, the commonest is child abuse, neglect, all those can cause mental illness.
There are certain triggers that come from the environment, and it identifies someone with a gene that is vulnerable. The likelihood of getting mental illness could be high.
Dr. Kenneth Kalani from the Department of Mental Health in Ministry of Health says there are triggers including psychosocial issues.
For children growing up, if their parents separate or there are these unrest within the family, these things can trigger. You know, they are significant stressors to them. We also know the socioeconomic strains here and there. We're struggling to meet basic needs. And for as long as people continue to struggle to meet basic needs, it places them in a very stressful circumstance, and this can potentially be a trigger.
Recent statistics indicate that 1 in 4 people suffers from mental illnesses such as depression and anxiety.
The most recent study conducted by Utaweka Hospital and Makerere University School of Public Health established that about 32.4%, there's a prevalence of about 32.4% of generalized anxiety. That's an anxiety disorder. And then depression at about 17.9% in the community as well. And then they found that 1 in 3 school children had high emotional problems.
We asked Dr. Wamala about the possible interventions open to this family.
We have those that are chronic, where an individual will be on medication and it's controlled. They are on medication, well controlled. Then we have those that need treatment, continuous treatment, then those that we treat and they really get better.
But what measures has the Ministry of Health put in place to increase access to mental health care and treatment across the country?
By policy, government recognizes mental health as a pillar of primary health care, and so it should be integrated at all those levels. We have about 13 regional referral hospitals that have fully fledged mental health units. That means they can treat and admit. These units are about 35 to 40 bed capacity. So we recognize that in the lower facilities, the capacity to identify and treat patients with common mental illnesses is low. So what we've embarked on is to try and build capacity of primary healthcare workers. And we're trying to do in-service training to ensure that mental illnesses can be screened and care provided at that level.
With 450 million affected individuals across the globe and a projected 1 in 4 people experiencing mental health conditions worldwide, the disease burden in Uganda is rising. Uganda now ranks among Africa's top 6 for depressive and anxiety disorders. Benjamin Jumbe, NTV Weekend Edition.
Now she tells us they are no longer giving her the medicine for the madness.